Hello. Well, hello. Um, I'm a little earlier than I usually am. I I'm gonna. Whoa. I am going to talk just a little bit about not being taken seriously. Um, just because I experienced it recently, and I had not experienced it in a long time. And when it happened, it brought back all the many times in the past, when family or friends or healthcare workers um, were just um, not just rude, but cruel in just their body language and sometimes verbally their words. Um, as you know, I'm sure everyone that has a psychiatric disorder, whether it be a mood disorder or an anxiety disorder or whatever psychiatric disorder, um, schizophrenia, whatever, you have had one of these things happen. um, and and it can really take you from feeling okay about yourself to feeling, excuse my French, feeling really shitty about yourself, all because of someone else. Uh, I don't walk around like for, first I have to mention I'm having a really bad hair day. I used this weird shampoo product and it left this nasty film, and it like doesn't move, and I can't rinse it out. And anyway, I also had a bout of insomnia the other day, and so I gave myself a 3 a.m. self haircut. So you can't see the back, which is good. But anyway, um, and forgot what I was just going to say. Um, I've had this problem more um, a long time ago. It's not as bad um, now, I think, but um, because I think psychiatric disorders are getting more accepted as real things and not something, not a character flaw or weakness or something. But I'm going to share with you some of the things that I have encountered. Oh, I was saying, um, I don't walk around telling everybody I bump into that I have bipolar disorder or social anxiety disorder. If if I'm having a conversation with somebody and it's appropriate to the conversation, I will say so that yeah, I have bipolar disorder, and because I want it to be I'm doing it not for myself. I'm doing it for everybody else, um, so that we don't have to feel like we have to hide that it's something we need to keep hidden and, like, something to be ashamed of. And I want them to see that I'm a pretty normal person. I mean, just like anybody, I have my quirks, but, I'm intelligent and whatnot. And yes, I have this disorder, and, um, depending on how well I know the person or what kind of personality it is, how much I divulge. Um, you have to read people. Uh, I I am gonna be looking at a list here. Um, my my memory's been really bad, and it's hard for me to um just take a topic, and I used to be able to just jot down what I wanted to go with, and then not even refer to my notes and get it all in, and it all flows. And um but lately I have trouble keeping things flowing, so I apologize if it sounds like I'm like choppy, if it's choppy. And I just also noticed, by the way, totally about something else. Um, TV shows. If I don't watch like that same show every night, an episode every night, I completely lose track. Please tell me I'm not the only one. I completely lose track of um the storyline. And then and what I have found, um being the resourceful person I am, adapt and whatnot. On YouTube, just about any show, you can find a recap of season this, episode this. So, like 10 minutes. So, if I get lost, I can usually find something that helps me um, get back on track. But it can be really, really frustrating to be like in season 3, episode 10, and I'm going, how did they get to this point? He's in jail, you know? And so, like, I'll have to go, I'll like have to sample each episode until I find one that strikes me as familiar and it's just crazy. Right now, it's Downton Abbey, and I just was like, um, but it's a little bit. It's not short term because it's short term is like just 2 seconds ago, but it's not long term where I lost chunks of my memory after the ECT, and my mom would be like, "No, you've seen that movie. We we went and saw it together." So there were a whole bunch of movies that I got to see for a second time for the first time. Okay, back to I'm sorry. Um Back to not being taken seriously. This can either be in regards to your disorder, or it can be about something else, but they know you have this disorder. So, um, my first, um, my first incident was right away. It was when I was 15. I I'd had symptoms of bipolar disorder, but um, it wasn't. What happens sometimes is I think they thought it was, just going through teenager until until my brain decided that decided to convince me that I would be happier. I not happy. I could finally be happy if I um trigger warning, if I went to the other side. It wasn't the kind of like, oh, my life is awful. I mean, yes, I'd been having problems, and yes, I had been depressed, but this is a weird kind of mixed thing that I have had several times. Um, my brain was saying, but there is happiness. It's not here on this earth with these people. There's happiness on the other side. You just need to get there. And so I took a bunch of pills um, to go to the other side to be happy. And I was happy. I was attempting suicide and I was happy because I was finally going to be happy again and feel pleasure and things. And I had this strangely psychic friend call in the middle of, because it was like a ritual I did throughout the day, culminating into the pill taking. And I did all the textbook things, cleaned my room, got dressed and put makeup on. And anyway, I was in the tub by the time she called. And I took her call and I'm trying to explain to her why she should be happy for me. No, you don't get it. I'm going to be happy. Finally. Why aren't you happy for me? Why are you freaking out? And then finally I was just like, I'm in the middle of something. I hung up on her. And needless to say, she called again and talked to my parents. And they got me out of the tub and to the ER. So I'm in the emergency room and they're giving me that charcoal to vomit, and by the way, what I took was I was 15, so, and was way back before kids were exposed to drugs. Vibrant and no-dose is what I took, but I didn't want them to think I took something that serious, so I told them Tylenol, thinking it was benign, and ended up in the ICU, and they're like, your Tylenol level is really low. But anyway, while I was in the emergency room and they were making me throw up, and I am throwing up pills, so they have no reason but to believe I've taken a bunch of Tylenol. Um, And strangely, at that point, I'm saying, "I don't wanna die." It was like I was woken up from a trance state, and I was like, "I don't wanna die, I don't wanna die." And the nurse said, "Well, you should have thought of that before you took all those pills." Um, and then when all the chaos died down, in the emergency room, they'd done all their things, and they were just sort of cleaning up, and I was still in that one, like, triage spot that's not, that spot where they work on you intensively, but it was all over, and I was okay. And that nurse said, um, she said, you know, you are, this is really stupid thing that you've done, and, that you've done to your parents, and you are wasting space and resources that could go to someone who's really sick. And I can tell you that I heard those words more than once, um, in the healthcare system, that I was wasting resources that could be used for someone who was really sick. So and what does that do? It gave me a sense of, um, that I was a horrible person, that I was not worthy of emergent care, that my my issues were, even though I knew there was something wrong with me, it was it was not important compared to people who have real problems, real health problems. You know, it and that's at 15 years old. So I got a really good start out on, how other people view especially the healthcare. This is would have been in 1985. It's different now, but it's different in their words. They're still thinking it. I guarantee you. I It wasn't the last time, I mean, that I ended up in the emergency room with a suicide attempt. And you can just read their body, just they make it very apparent. They don't say the words anymore, but they believe it. You're wasting, and I had to be in ICU once for about 3 days because of the medication that I chose. That was a different kind of attempt. I was trapped. I felt trapped. It didn't have to do with me being psychotic or depressed. I felt trapped in my well, I felt trapped in my disorder, and not being able to work, um anyway, I was in ICU because that medicine could affect your heart, and so I had to be there for about 3 days. And the nurses did treat me like, I'm wasting a bed for someone that was, because oh, and here's this is in my notes. In the one with the medication that I took that I took as an attempt, and it could affect your heart. And get this, this is where you They do it even in the insurance company. Get this. My insurance company paid for the psychiatric hospitalization I had after getting out of the ICU. But they would not pay for my ICU stay because the injury was self-inflicted. And I sent them I don't know what you want to call it, but it was this thick of paper about bipolar disorder and how excuse me, I, as an old habit I have to get out of, stupid, hold on, medication time. Okay. That the disorder they were paying for in the psychiatric stay was the same disorder that caused me to attempt suicide. So where's your logic? And that my disorder is a medical condition. They can look at a PET scan and see someone in a manic episode as to a normal. There's all kinds of red hot stuff going on. What is today? Wednesday. So, yeah. So they ended up paying for it. Let's see. Oh, the word selfish went around. I was being selfish for taking up a bed for someone that was really sick, that really needed it. I was wasting their resources. Excuse me. Okay, so I've encountered a lot of that. My current primary care physician, she can't wait to get out of the room. And I don't know why. I'm a pretty normal person in there. But she's uncomfortable with the bipolar thing. I don't know what it is. I don't know what she's thinking. But it's really weird. And I've had this happen with other doctors and nurses. You can talk about when I say physical health, I get upset because with our disorders, there is something physical happening. There should be, we have a brain disorder. Okay. Some people have Parkinson's. Some people have schizophrenia. With Parkinson's, the brain, the little neuron thingies are not getting enough dopamine. Schizophrenia, they're getting too much. And yet they are separated. That's bull. It is a physical illness disorder. And yet, anybody who's not in the psychiatric world, I'm not including counselors, therapists, social workers, because that's a whole different ballgame. But when you talk to a psychiatrist, but even sometimes they are condescending and don't take you seriously. but for the most part, you're talking about your disorder. But I find it when I go to like the ER for what I've been to the emergency room for, you know, I got at the animal shelter. I regularly got bit by something, cats and a rat. Um, Dogs, I was good enough with dogs. I never got bit by dogs, but um, you know, protocol is you have to go anyway. Whatever reason, I would go to the ER. As long as you're talking um, about physical disorders, they're fine. Um, and then um, and then you hit on your bipolar disorder and your social anxiety disorder. And especially as soon as you say I take Xanax, they don't even listen. They just like stop listening. They don't even let me finish. They've already judged me right there. And they are not going to take anything I say, anything I come in for seriously. I take Xanax at bedtime every night. I can take one as needed during the day. And that is usually rare occasions, such as I have to speak in front of a group or I have to go to a major social event. It's not an everyday thing. And I'm lucky because there are people that have to take it more. But as soon as I say Xanax, I'm written off. Yeah. So, because I'm not strong and just don't deal with it. And I'm like, the only reason you feel that way is because you have never felt how I feel. And if you ever felt how I feel, you were looking for a Xanax. So, um, here's an example in my life how a psychiatrist um, did not take me seriously. I mean, I just wanted to punch this man in the face. And now thinking back, I want to punch him even harder. No, that's not a threat, YouTube. Figure of speech, sorta. Um, I in the beginning, they did not have lithium CR, continuous release. They did not have Seroquel at all. And and they tried to put me on lithium, and before I would even get to anywhere near a therapeutic dose, this is how I held a cup. I mean, I could not do anything. I had such bad tremors, so I could not take it until it came out in CR, which was years later. So I had to try, which none of these worked. Depakote, Neurontin, Topamax, Triliptal, Lamictal, and then of course there was Abilify, Risperidone, Zyprexa, and all the antidepressants. And none of this stuff worked. And I found myself both bipolar depressed and situationally depressed. And it went on for a year. And this is why I have a kind of, I don't like small town psychiatrists. I don't trust them because I don't think that they're keeping up on the latest. My psychiatrist needs to primarily know their pharmacology. I don't care anything else about them. So he's getting annoyed with me every time I show up, and I'm just, like, crying and I'm depressed. Well, I'm crying and I'm depressed in big part because I am not responding to the medication, and the medication's making me gain weight, which just added to the whole problem, and I and he got angry with me for being depressed. He was just like there was, like, no compassion at some point. I'm sure he got frustrated and everything, frustrated and but it wasn't a frustrated on, "I wanna help this person and I just can't find the right thing." It was frustrated and, "Oh my god, I probably have to see so and so today. It's gonna ruin my whole day. She's such a bummer. She just comes in and cries the whole time." So, without any help from him, a while later, I ended up with a different psychiatrist and getting the ECT that caused my memory loss. We don't know if this current memory loss issue is a lingering effect, um, but we do know that I had memory loss that they did that I was not supposed to have. So, he he I he just did not take my position seriously. I think his problem was more compassion. I needed I mean, I could imagine it was frustrating, like I said, but my god, you don't get angry at your patient because you can't because he was angry because I should be able to just buck up, pull myself up by my bootstraps, and get a hold of this. But it was impossible. I was in that kinda I was there was, like I was messed up. I don't know that I've ever had that kinda depression, that the ruminating never ended. Just I was tortured day and night, and he gets angry at me. So, I don't the only other there was another psychiatrist in that tiny town, and I refused ECT at first. Um, damn it, I refused it. I was not going to get ECT, and it turns out that he was pressuring and getting all these patients to do ECT because he was doing a study. Anyway, then at that point, I was like, "No way, I'm not having ECT." And a nurse said to me, "I can't make you want to get better." So, that was on the evening shift. That morning, I called my mom, and I was like, "Mom, I'm leaving." And they weren't gonna let me leave the hospital, and I told her what happened. And my mom came and she's like, "She's leaving. We're leaving." So, um, I only hope that you have someone in your life that will be that person that can be that person to, "Nope, Sorry, we're leaving. She's leaving. Come on. Anyway, let me my voice is starting to go because I'm getting so worked up. Okay, so I talked about the oh, okay. And then so then there's when you have a problem like I don't know, just something somebody goes to the doctor for back pain. I've got this back pain, I have this this swollen foot or pain down my leg and you go and the doctor scans your little sheet that says your history and they get to um, that you have bipolar disorder, schizophrenia, personality disorders, probably get it worse. And everything's hunky dory. They probably already are thinking in their head what tests, what they're going to say to you, what questions they're going to ask. And then as soon as they see a psychiatric disorder, it all changes. And I have felt that as time has gone on, that lately this happens less and less to me. But I always know the second it happens because suddenly the doctor won't make eye contact. And I had this happen when I have something called trigeminal neuralgia. Look it up. Its nickname is the suicide disease because it's so painful that people were killing themselves over it. And it's like a shooting pain, nerve pain that goes in your head and your face. And I had that. And I had bad insurance. I had back when they had HMOs, Humana. Should have sued Humana. And I go there and there's a term that I want to say, but then I might have to make this 17. Jerking me around. And so this is what he finally says after a few visits. He's like got my chart. He's like at my chart and he's got like his head like almost like in the chart. And he without looking up, without looking at me, he goes, because of my history, he says, well, sometimes people with depression have these types of pain and it's not that you're not feeling it. It's just that there's no physical. He would not look me in the eye. And I almost leapt off the little table and strangled him. I was like, this is not psychosomatic. I'm a registered nurse. I know what I'm talking about. And so he tried to get me to not ask to go any further in assessment of the problem, investigation of the problem. I insisted on an MRI. I insisted on a neurology consult. And yet the Humana doctor tried to lie to me. It didn't try to lie to me. He lied to me, but I knew the truth and I caught him. And as soon as I was eligible to change doctors, I went straight to my new doctor and she said, "You need to go see this guy." 2 weeks later, I'm having surgery and they just put these little sponges in and boom, it was gone. I if I had not taken matters into my own hands because of my history of this is before I was diagnosed with bipolar, I just had depression on there, but because of that word, depression, on my chart, if I didn't know better because I was a nurse and, pursued it, I could still be in pain to this day. Oh my god. It was like the kind of pain that you, like, drop no matter where you're at, you drop to your knees, grab your head, and start screaming. So, it's like at work and it happened. It's like the shooting pain. And his goal was to save money because the less money he spent, the bigger kickback he got at the end of the year. That's our healthcare system. That was in the 90s. But like I said, you can tell when it's happened because they're like, fine, and then all of a sudden they won't make eye contact with you. Like you're an alien or I don't know. So that's the medical field. Oh my god, I've been talking for 42 minutes and I still have more to say. I'll try to hurry it up. Family and friends. Oh. This is let me see. Okay. This is specifically the trip I recently had in Michigan. So I'm going to try to be sensitive but get my point across at the same time. Previous visits, I had more than once explained that I have a kind of schedule that I need to adhere to, particularly regarding what time I get up and what time I go to sleep. And why. I have bipolar disorder. And I don't it I felt like when I got there and I was exercising this, what I would ask, well, what time are we going to be doing whatever we're going to be doing tomorrow? So I can plan on when to get up. I mean, but like anytime I said something about my schedule that I needed to adhere to, I got a little bit of stink eye. Like, aren't you here to have fun and spend time with us? And so your schedule can be altered for this visit kind of thing. Like, what's do you know what I'm saying? Just a little bit of a stink eye, um like it might be inconvenient for other people. I understand that, but if you know, not not know, not know, like I've told you, if you have been around and know and experienced me depressed, frustrated, angry, depressed, manic, you're going to say, whatever you do, stick to your schedule, please. So, um, yeah, uh, even though I express how important it is, I get the sensation that it shouldn't be as important as um you should you know I just don't know how to explain it. um like I'm putting other people out. Do you know what I mean? I mean, you wouldn't say to somebody who has diabetes, well, your blood sugar's low. Well, we're going to eat in an hour. You can wait. So, like that. Um, but this past time I was there, I I, I saw an opportunity to explain a little bit more about my experience with bipolar disorder, because there are different levels. I don't think you want to like attain certain levels, but um in my case, it's not that I get moody sometimes. Like, I don't know, some people maybe. I don't think that's not bipolar disorder anyway, but um somehow my biological father was across from me at the table, and his wife was doing dishes right there, and dog it, was talking about my dog, and that he's a service dog, and that he makes sure I take my medication on time. And so I was able to segue into why it's so important for me to take my medication at the same time every day, and that I not forget. And that, well, before I had these medications, I was in the hospital a lot. Um, I had suicide attempts, I had psychosis, I was hearing things, seeing things, um, outbursts, embarrassing outbursts in doctor's offices, and my mom ready to just abandon me and move away because I would get so, um, what is agitated, and what is that word? It starts with an O. But, and I thought, here I am, like, talking, and then at one point, my biological father, see, we all kinda joked that, my shaky hand is from his side of the family. I saw all these family members, and they're all shaking, and so we know where it's coming from. And so when I'm talking about this, he says, "Well, gosh, I hope you didn't get that from me." I'm like, "Way to go to think about yourself when I'm trying to tell you about something that, um, is sensitive, you know? And I hope you didn't get that from me. So I guess you're hoping I got it from my mom." Well, I hate to tell you this, but there's no history of it. So, uh, and there is a history, I think. Not everybody with bipolar disorder gets diagnosed. So, anyway, I was like, oh, and tried to continue with what I was talking about. I just let that slide, and because I needed them to know this. And his wife just kept saying, I'm so sorry," but it didn't feel sincere. It felt like rote, like, this is what I'm supposed to say when people talk about these things. So I say this. I didn't feel any real emotion behind, like, "Oh, I'm so sorry you went through that. That sounds terrible." It was like a robot. "Oh, I'm so sorry." Didn't feel like she was. And so I was like, "Okay." And I could just, like, read the faces and like, maybe they were uncomfortable with it. And I don't know why you should be. Maybe they're like, "She's making us really uncomfortable. Maybe I wish she would not talk about this because it's making us feel uncomfortable." Maybe that's it. But I mean, my biological father did ask a question. I give him that. He said, "Well, what happens when this BD acts up?" So he did ask a question. Um, and so I continue to try to talk, and I think I was saying a couple other things that maybe that my dog does for me. And then all of a sudden, they start talking to each other over me about something else. Like I'm in mid sentence and about this. And I cannot tell you how that hurt my feelings. That really did. Um, that made me feel really bad because that told me they weren't listening and they really don't care to know. They don't care and they don't care to know. Um, I'm I want them to know. I want people to know because I want them to know that I have been this bad and gotten myself up again, only to have the disorder pull me down, and I get back up again, and I get pulled down, and I get back up again. I don't stop. I work hard. They, these doctors, these family members, social workers and counselors and stuff, a lot of times, yes, cognitive behavior therapy is a must. You will not, it will be so hard to get through, especially the social anxiety, um, without that. But that's something you can take with you. You don't have to stay in therapy forever. You can take those, you learn them, you take them, you use them to get back up again. And I like people who want, it's like, okay, I think you want to get to know me. So I'm going to tell you a little bit. I'm doing pretty good right now. For someone who has bipolar 1 disorder and with mixed and um and social anxiety disorder, But I go through periods of seeing things, hearing things, depression to where I'm completely blank, staring at a wall. I don't know how long I've been staring at this wall. I'm struggling to find words, and I'm manic. I can't sleep. I'm walking the streets through the night. I'm crazy think. I'm a danger. And I I get back up. And now I'm doing the dog training, and I am on disability, but I don't make enough. I'm allowed to make this much. I do report it. Um, it's just to have a little extra to help pay for the medication, and and I make my appointments. I go there. I communicate. You know, I do. If I did not do everything I do, I don't even want to know. I'd be dead. Somebody else might be dead. I'd be on drugs. I'd be in jail. I work hard to be okay. And so it hurts my feelings when people don't take my disorder seriously. Take it seriously, because it takes a lot out of me to stay as stable as I can. And I'm proud of that. I want people to know that, I've heard voices, conversations through the wall. I've had really bad episodes, but I work really hard. I'm proud of it. And whenever someone doesn't give me eye contact, talks over me, tells me I'm not really sick when I am very sick, it hurts. And see, I'm going to start crying now. So, anyway, that is my little talk about me and my experiences. And I'm absolutely sure that you have experienced this as well at some point. I hope you don't, or don't anymore. Um, it's from 1985 to now. As far as psychiatry goes, and the acceptance of disorders, I think it has improved quite a bit. But I know that there are still some nurses out there in emergency rooms telling overdose patients who have attempted suicide, saying, you know, you're wasting resources in a bed that could be used for someone that's really sick. And if they don't say it out loud, they're thinking it. But don't forget the fact that psychiatric disorders are physical disorders. There is something physically going on in your brain that is not how it's supposed to be, and it causes certain behaviors when it's out of whack. It's not weakness, it's not attention seeking, it's not feeling sad because your boyfriend dumped you. It's not, hopefully, drugs or alcohol, except a lot of people use that for self-medication. But, be proud of how hard you work, um, and any successes you have, be proud, and, um, I somebody on YouTube that has cystic fibrosis, and there's a whole YouTube series she does about life with cystic fibrosis. Um, she's sick. She has to take care of herself, but she lives life and is smiling, and we're no different. And I have to tell you, I have to say this. Um, we do have an illness that could potentially take our lives. A lot of people don't want to talk about that, hear about that, or admit that. Bipolar disorder has a very high rate of suicide. Um, in a bad episode, yeah, and especially with mixed episodes, because you just want it to stop. And and you're struggling I mean, I'm making a YouTube vlog about bipolar disorder, and my disorder I have to work on. I have to take treatment. I have to whatever, and there is a potential for death. So, probably not to the degree of cystic fibrosis, but I think you get what I'm saying. Don't let anyone convince you that your disorder is any less serious than other chronic physical disorders. That's what I'm trying to say. Okay, so I'm losing my voice. My dogs are getting all put out because we're supposed to be doing things right now, getting ready for bed. I feel like this was one of my better talks because I could really get into it, and my mood's been really well. Um, just a little anxiety while my mom's not here. She's kind of like my grounding, my touchstone. Is that the phrase? Um, so now I'm all excited and I have to bring myself down. I wish you all a good night, good day, and be proud.